Please tell me a little bit about yourself, about your experience,
Uh,
what you do.
I'm a psychiatrist that has been in practice for over 30 years, mainly treating depression, bipolar disorder, schizophrenia, panic disorder with medication. And I trained at Georgetown Medical School, and then I did my psychiatry residency at Columbia Presbyterian. About 6 years ago, I added TMS, Transcranial Magnetic Stimulation, to our modalities of treating depression, and it's had dramatic benefit.
But before the TMS, doctor, how a person will know that he have depression, clinical depression, that he really need to treat? How can mother in home can know that the son is really depressed or just like in a bad mood or something, or wife or husband has to call?
Yeah. Depression is not just a depressed mood. It's really a collection of symptoms, and the symptoms include these. There's a sleep disturbance. Either the person is sleeping way too much, or they're having difficulty falling asleep, or they're waking up in the middle of the night, or they're waking up early in the morning and only getting 4 or 5 hours sleep and are tired all the time. They have an appetite problem, usually a decrease in enjoyment of food, sometimes weight loss, but it can also be the opposite, craving carbohydrates and gaining weight. They're low in energy. They don't enjoy things as much as they used to. They just don't take as much pleasure in things. They don't have the motivation, the excitement to go out and to see their friends and do things. And sometimes they feel excessive guilt, like little things they'll worry about and feel guilty about, and think about things in the past that maybe they made a mistake about, and they'll ruminate about it. That's a frequent symptom. And they often have wishes to be dead, or feeling like, gosh, I wouldn't mind if a truck ran over me. I'd be better off dead. My family would be better off without me. Now, they usually also have a depressed mood, although I've had a couple of patients who actually had depression and didn't feel depressed, but they had the other symptoms. So when we call a depression, it's not, we had to pick a name. We could have called it low energy syndrome, or we could have called it McMullen's lack of enjoyment syndrome. But we had to pick a name, so people picked the word depression. But it's not just the depressed mood, it's these other physical symptoms. Now, there are milder depressions where the symptoms are more or less the same, but much diminished. They're not that severe, and maybe in those cases, the most prominent symptom might be that they're mildly depressed and negative all the time, and they're a little pessimistic, and they have a little low self-esteem, and they're feeling sad most of the time. And those milder depressions, which we sometimes call dysthymia, which is just another word for mild depression, those depressions are partly what made the first big antidepressant, Prozac, famous, is because that was the first antidepressant we had that could easily treat mild depressions. And it didn't have a lot of side effects, generally.
So how a person will know, let's say I don't sleep a few nights and a lack of appetite, so how soon I need to see a doctor?
Well, if you're not sleeping too well and your appetite's down and it just goes on for a few days, then you probably don't have that much to worry about. But if it's a lack of appetite and, I'm feeling bad about myself, I just don't feel like I'm adequate, I don't feel like I'm doing enough in life, and I blame myself for this and that, and I just don't feel like seeing friends, and I don't enjoy seeing friends, and I have these thoughts going through my mind, I kind of wish I were dead. If you're having those for even a few days, you're probably having a depression that's lasting a few days. And you ought to pay attention to that, because eventually you're probably going to have that depressive period lasts more than a few days and lasts a couple of weeks or a couple of months, and then you should definitely get it treated.
Now I know that I'm depressed more than a few weeks, so who I need to call, a psychiatrist or a psychologist?
Well, that's a difficult question, and there's not a good answer, but I think that if you've had long periods of feeling normal, and then you have periods of depression that come on either out of nowhere or because of circumstances, you get into a depression for a few days or a few weeks, I think it's perfectly reasonable to go to a therapist first, to go to a psychologist or a social worker therapist who specializes in treating depression, especially what we call cognitive behavioral therapy for depression, although there's other treatments. Because frequently they're very successful with people by teaching them how to think differently and to argue with their negative thoughts and to change their behavior so that that they do things that'll help them come out of their depression, which can be just as simple as getting a lot more exercise, like 5 hours per week of vigorous exercise, of forcing oneself to go out and socialize as one normally would. There's a bunch of actions like that one can take, as well as working on your negative thinking and arguing with that. And then if the benefit from that doesn't hold or it doesn't happen, then I'd be more serious about going to see a psychiatrist. Now, if you've been depressed for years and it fluctuates a lot, but you've almost never felt in a normal mood, I would probably go see a psychiatrist first and then add on the psychologist therapist to that, because you're probably going to need some medication or TMS or something to put this tendency to depression in complete remission.
So what are my chances to be cured?
Well, I don't know that people get cured so often, because chronic illnesses are by definition chronic. So if you've got hypertension, or you've got arthritis, or you've got adult onset diabetes, or psoriasis, all of these things are chronic, and so is depression. If you find the right medication and it works, sometimes if you stay on that, it'll keep working, more or less permanently for years. And you're not exactly cured, since if you come off the medicine, the depression comes back. But for all practical purposes, if you put the depression in remission and you don't have many side effects, that's not bad. I've been on antidepressants for 28 years. I take something called, well, it doesn't matter what I take, but I take an antidepressant and it works. And I feel fine. Now, if I stop it, then within a few days, I'm getting very depressed. And in a week or two, I might have to retire. I get that depressed. But I'm lucky. It works. And this is the way it is with a lot of people. Now, even with TMS, Transcranial Magnetic Stimulation, that puts people in remission for a long time, it's not really curing it, because they usually need to stay on medicine. It's just the medicine that used to only partially work is now working 100%. So they're still staying on medicine to stay out of it. And they're still likely to relapse at some point and break through, a year or 3 years after the TMS. They may have the depression come back and they may need a few more TMS. So it's pretty hard to get a cure. Now, if you break a leg, you can cure that. You put it in a cast and let it heal, and after a while you can take off the cast and you're just the way you were before. It's not a a long, permanent problem. And but many of the disorders that we have are chronic, and depression happens to be one of them.
But so, as I understand you, I have very good chance to live normal life.
Yeah, absolutely. See, that's the goal. And with many of our psychiatric disorders, even the worst ones now, you have a chance of leading a very normal life. You know, back in 1950, in the United States, there were maybe 100 million people, and we had 500,000 people in state hospitals. There were huge state hospitals like Pilgrim State, others.
Mental hospital.
Mental hospitals. And now, how many people do we have in state hospitals today? We have 50,000.
Wow.
Not 500,000, but 50,000. And the population is 3 times as much. And the reason is the medications that came out in the 1950s. And then, you know, more and more medicines came out. We perfected how to use them. But nowadays, we have many people that say have bipolar disorder, like manic depression. And they're functioning perfectly well. They're married, they have a job, they have children. You never know they had a problem. But many of those people before 1950 would have been in a mental hospital for years because there was no way to treat them. And I've met people who, I remember one woman in particular, she said it was a nightmare that she would be going into the mental hospital every 2 or 3 years, and it'd be there for months or a year, and she'd have these psychotic episodes. She was manic depressive, and she'd have these manic episodes, and it was extremely humiliating. And she'd come out and she'd get a job as a secretary, and then it would happen again. And then sometime in I forget when, but at some point, lithium was available to her, and everything changed. She said everything changed. Suddenly, she stopped going into hospitals. She had a normal life, and she was never hospitalized again. And I met her actually in a hospital when she was having a mild to moderate depression. She went in for a medical problem, they thought, but it was actually some depression, and we just changed her medication a little bit, and she was back functioning. But when people describe the nightmare they went through until the new medicines came out, it's pretty dramatic what's happened.
Thank you very much, Dr. I gave me a help.